What's going on, guys? Medicine in 3 minutes back here with another video, and today we're going to be talking about cricothyrotomy. We're going to get straight to the point. We're going to keep the subject clear, brief, and illustrated. So let's get started. Now, before we dive any further into cricothyrotomy, we need to understand the anatomy of the throat. Now, we need to understand where things are located in order to understand what's going on. So first we have the oral cavity. That's going to be your mouth. The nasal cavity. That's going to be, again, your nose. We're going to have the pharynx and the esophagus. Now those are going to be posterior. And then on the anterior side, we have the larynx and the trachea right below it. Okay, now that we have a general understanding of the anatomy of the throat, we're going to dive deeper into the main component affected in cricothyrotomy, which is going to be the larynx. Now, when we're looking at the larynx, I put this lady here just so you guys can understand the perspective in which we're looking at it. We're looking at it from a side view. And when we're dealing with the larynx, we're going to have three main cartilages. Now, the first at the top right is going to be the thyroid cartilage. Top left is going to be the arytenoid cartilage. And down below is going to be the cricoid cartilage. Now, up here is going to be the vocal cords. And yeah, that's essentially the main three things we want to worry about when we're talking about the larynx. Okay, now when we want to take a look at the muscles in the larynx, there's going to be four main muscles that we're going to look at when it comes to functions. As you know, we're all about visualization in this channel. So if you want to remember, the muscle that opens cords, which is going to be the cricoarytenoid muscle. I use scissors that are open, so you remember open scissors means opens the cords. Now when we look at the cords when they're closed, we're going to see closed scissors, and that's going to be the inner arytenoid. And as you can see, the scissors are closed, therefore it's closed cords. Here we have a T-Rex stretching his jaw. Now you can use that as reference to stretching cords. That is going to be the function of the cricothyroid muscle, which is going to be located right here. It's the blue right here. And finally is going to be the thyroarytenoid muscles. Now they put tension on the cords. Now you can just think of a guy who, an athletic Olympic lifter. There's a lot of tension whenever they're doing sports. So I just like to use those visuals to remind me when I'm thinking of muscles. Okay, now that we spoke about the larynx, we can slowly start putting the pieces together. Remember we spoke about the thyroid cartilage and the cricoid cartilage? In between them is going to be something called the cricothyroid membrane. Now this is important to note because this is where you're going to be making your incision. Obviously you guys don't know what I mean by that, but just keep that in mind when we talk about the procedure. Okay, now that we've understood more about the larynx, we can actually dive into what cricothyrotomy is itself. I just want to say that this is an emergency procedure. It only provides a temporary airway. And the important thing to note is that it is only used if intubation has failed. So that means when you use a laryngoscope, put it in the throat, use it to create a temporary airway, and it fails, then you're going to want to go into cricothyrotomy. What are the reasons that this might fail? It could possibly be due to an obstruction at or above the larynx. Now, this could either be a foreign body, angioedema, or facial trauma. Okay, now that we understood what cricothyrotomy is and its purpose, we can go into the procedure. Now, the procedure is very important. We looked at the thyroid cartilage, the cricoid cartilage, and the cricothyroid membrane. We know where they're located from a head-on standpoint. Now we can start figuring out what we need to do. Now, the first thing, you want to look for the thyroid cartilage. Now, we know where that's located. It's going to be above the cricothyroid membrane. And then the second thing you're going to want to do is look for the depression in the cricothyroid ligament. Now, that's going to be in the cricothyroid membrane itself, but you're going to want to look for the ligament. Now, the third thing is going to be incision in the midline of the ligament. Now, in the midline, there's going to be an incision, and that's where you're going to put the fourth step, which is going to be an endotracheal tube, and that's going to be to secure the airway. Now, once that is inserted, then you'll have an airway for air to come in. Now, here's a side view of the incision. This is going to be the general location in which you're going to be performing it. I do want to note that while I am using a needle, here as well, I'm using a needle. That has nothing to do with the incision itself. You most likely will not be using a needle. It is strictly here for visual purposes to make the point clear that you're supposed to make the incision. Okay, so thank you guys so much for watching today's episode of Medicine in 3 Minutes. Make sure to hit the like button, subscribe if you're new, and if you're already subscribed, leave a comment down below. We'd love to hear what you guys think of the videos, if there's anything we can improve on, if you just generally like the video, or if we made a mistake. You know, we're all human here. If there's anything that you see that we could correct, let us know down below, and we'll catch you guys next time. Thank you guys so much. Have a good day.